Say hello to my guest, Richard Vincent, here at LSI 2022. What's happened to Fundamental VR since I saw you last year?
Well, it's been an amazing year. What we've seen across the industry is a real pickup in the use of virtual reality for surgical training. So we've just seen a number of new med device, life science businesses coming on board, using the platform. It's kept us really busy.
Well, that's kind of the whole point of Fundamental, isn't it? To kind of drop that learning curve. How are you helping to change the dynamic and get products out faster? How do you help them?
Exactly that. You know, the perennial problem you've got inside the medical device or pharma business is how long it takes to get through a learning curve. You know, what we can do at scale for our customers is to give them the ability to put their customers, surgeons, through a repetitive process of learning skills and knowledge. And the important thing really is using our haptic VR system, we can allow that skills transfer to happen more effectively than you would do just with the traditional ways of training.
Oh, that sounds great. Can you give us a concrete example? Like, what's a big win or something that you can talk about where this has happened and you've seen those surgeons drop that learning curve? Tell us about one of those.
Yeah, absolutely. There's been a number of great examples over the last couple of years. One that springs to mind is with one of our great clients, Novartis. So for one of their gene therapies, what we've seen is that they've adopted our platform now instead of all of the traditional approaches to training. We've seen a reduction in the time it takes to get to that really precise skills level, and they've rolled it out across the world. What we're seeing typically is somewhere between 30 to 40% improvement in the speed and accuracy of skills transfer. So it's really pushing down that learning curve.
So are you finding that these particular surgeons, is their confidence level going up? Because gene therapy, you're talking about there could be a big price tag on that Novartis product.
Absolutely, yeah. So confidence and competence don't necessarily rise at the same level. So actually getting both of those moving is really important, and we're seeing that happen across the board. You're right. There's a lot of complexity now in a lot of the devices and the drugs coming through onto market. So getting to the right capability as quickly as possible is good for a patient, it's good for the surgeon, and ultimately it's good for the medical device or the pharmaceutical business.
So are you seeing this training platform? Is it going deeper in? Is it kind of staying with the companies? Are you reaching medical schools? How far is this being deployed?
It's got a universal appeal. We've chosen to really focus it into the life science marketplace, so the medical device and pharmaceutical businesses. But where they then take it is into both the hospitals and into the training environments that you described. So yeah, it moves across all of those different channels.
Oh, that's kind of exciting. We had one of the guys this morning talk about, he was a surgeon. He says, if I do something well with my patients, I'm treating them one at a time. But if I put that into a product, I'm changing the standard of care, in hundreds of people and people I may never meet. And it seems like you guys are having that same kind of spreading influence as it just sort of ripples out through your partners.
It's a multiplying effect that you get. And it's not just within the products, as your other speaker mentioned, but also if you think about surgical skill, you may have only 3 or 4 leaders in the world in a particular technique. Well, what we can do with our platform is we can digitize that and give them almost infinite scale. So no longer do they need to get on a plane to move somewhere. They can virtually move there and be there through our collaboration system. Or indeed, we can take that skill and apply it and replay it into other people's experiences on multiple occasions. So it's got many, many really exciting applications.
So it seems like you could have the digital master trainer for a surgical technique, record that, digitalize it, and then other people can sort of play that training package?
That's exactly it. Yeah, that's exactly it. You can run through it as if that expert was there with you in the room. They're there virtually, their avatar is there, they can give you that guidance based on what you're doing. So this isn't a video, this isn't preset, this is real life, real play, but in a virtual environment with a virtual patient that you can touch, interact with, and go through those procedural steps until you get to the point of true proficiency. It's what I call pre-human competence. The days that we learnt on human beings, whether those are specimens or alive, those need to be behind us. And we're starting on that journey now with platforms like ours.
Yeah, I remember you giving me that example of, the day will come whenever you don't go through, cadavers, and you're not doing rabbits, you're not all these, actual living, you are modeling it. And I think there's probably a tremendous amount of that learning curve before you ever get to your first cadaver. Are you seeing anything like that?
Yeah, absolutely. So you can get more out of those traditional cadaver-based training experiences if you've had a chance in a digital environment inside our virtual space to go through that process. So just as you would swing the bat 20 times before you stepped out onto the picture location, then same thing. Well, I guess in my world, it kind of standing out for cricket. Same thing, you want to rehearse that movement. You want to know that you've got it right, and you can do that so you get the best out of either the cadaveric experience, or if you're moving straight into an operating room, you get the best out of that situation.
Richard, it seems like because of that learning curve getting pressed down, not only cadavers, but maybe there are people that are not getting, they're being saved from suboptimal therapies. Is that another benefit you're finding?
What we're seeing here is as you reduce the learning curve, you're reducing the impact on real people. If it takes 60 or 100 cases to get to the optimal level of performance, you're passing through real people in that process. So anything you can do to reduce that down, massively important. It has a real human impact on the way that people end up living their lives.
So I'm a surgeon. I want to practice on your system. What am I going to take out of the box? What do I have to have? How do I get this going?
So it varies depending on the use case and what the surgeon's trying to learn or achieve. But in simple terms, it's a VR headset. It will then have either some haptic instruments that they're holding, or it may have haptic gloves that they're interacting, so they virtually feel, but it's nothing there. It's all within the power of the gloves or in the tools. Or at the simpler end of the spectrum, it could just be simple controllers. It just depends on what we're trying to achieve. But in most cases, you need that sense of touch. You need that sense of resistance or flow or the fingertip information that's coming through. And that could be delivered through a set of gloves, a set of controllers with a VR headset. And here's the great thing. You can do that in your bedroom, in your office, in the OR, anywhere in the hospital. It's tiny. It travels in small cases. That means it's really simple to get it up and running. Anyone can use it. And we can bring people together. So collaboration, teamwork is a massive part of any surgical workflow. Well, we can create that collaboration without asking you to travel. So you can be in your house, I'll be in mine, and we can come together inside an operating room and practice together.
Does that go all the way down to the level of the scrub nurse, maybe the attending? They're all in that. If they have the headset on, they're passing the instruments. It goes to that level.
Absolutely. The system taking live feeds from a live OR into our collaborative OR, and then they're annotating onto it, rehearsing, practicing with those tools in concert with the real life environment. So
you're mimicking the surgical setting down to that level. Yeah. So what they would actually be interacting with, the data they would be gathering and recording.
We're watching eye movement, head movement, decisions you make, respect for tissue, your flow of hands and such like, and using all of those to build up a picture that we can then in real time feed back. So we don't say, it kind of looks like you got that slightly wrong. We can say, okay, you're 2 millimeters off the optimum point. So take another go at it.
It's like almost like a flight simulator. No, we actually want you on the left side of the stripe. Put the tire there, just that precise, which would be something a pilot would never dream of being able to do.
Right. It's a great analogy. Flight simulation for surgery is a great analogy. There are a lot of incidents that happen in a surgical environment across the whole team, and you don't want to face it for the first time with a live patient on the table. So to create the opportunity to run that scenario and find out how you work within that stressed environment with situational awareness, with full senses of sight, sound, and touch. For me, it's the next stage of where the life science industry needs to go. And we're really happy to be part of that.
Richard, you told me about the versatility of the fundamental VR system. And one of those aspects was patient variation. So anatomical variation and different types of people. Tell me more about how you can practice on that.
Yeah, well, so we're all very different, and pathologies are different, and disease states are different, and being able to allow for those within a simulation, again, takes it to a level that you've never had within most traditional training techniques. So what we're able to do is present the variations and allow the surgeons and the trainees to run through those different scenarios. So you might be a 20-year experienced surgeon in a particular area, but may never have come across a particular disease state or presentation. Well, if it's in our simulation, you can take a run at it beforehand. So your first time of facing it isn't with a live patient in front of you. You've had a chance to run through that scenario and see it there. It works really well. We talk about specific patients. So taking the specific data that comes out of a patient case and turning that into a training case that allows you then to deploy that to others, to allow them to get access to that knowledge and skill.
It just sort of dawned on me, some of my other clients are entrepreneurial surgeons, and they get there because they're the ones that see the problem. And now I'm beginning to realize, and then when something happens or it trends that way, there's a referral network that you've got to go to the tough guy. Well, now the tough guy can run that case, train others, and now we've got that variation, which maybe there was only a few surgeons that knew about it. With your system, you can now carry that out, and now that tough case that maybe a small percentage have seen, more people get to train on it.
Absolutely, yeah. If we can get it ingested into the system and digitize that knowledge, that skill, that capability, and that surgeon's insight, it can then be rolled out as you wish.
Wow, just taking the standard of care and just elevating it just through a digital training system.
Yeah, absolutely. The insight that comes through, the understanding of how your skills are developing and progressing, or perhaps are not, and actually starting to wane away. It allows you to see those, to see the signals of that happening within the data capabilities, and to take actions. And it may be that it's a case of going, okay, well, based on what we're seeing in the simulation, we need to do some coaching in another area. It may not be always inside the simulation, but it can give you the signals to say, let's make sure we address this before there's a challenge, there's an issue, or a confidence drop-off.
Wow. Anything else you can share with us about FundamentalVR?
Well, it's, as I said at the top of the meeting, it's been a really interesting couple of years as we've seen the market really adopt this. We've gone from innovation to a thing that I think most of the industry recognizes is a key pillar of the development of where we're going. We're really excited about the journey into these new disciplines and areas of surgery, taking in gene therapy and ophthalmology and interventional, and really look forward to keep pushing the envelope in those areas.
Will you come back to LSI and keep telling that story? Give us the next chapter?
Absolutely. Well, LSI in London is coming up in a couple of months' time, so I'm looking forward to being there. I don't have to travel over to the States for that one, although that's no big challenge. Look forward to being back here.
Just must be horrible to come out here to California.
This is such a great location. Scott and his team, they always pick the best locations for this. Yep. So very happy to be back here. Looking forward to being back here next year for sure.
Well, and it sounds like you actually have actual knowledge of the venue in London. You know that hotel.
Absolutely, the Grove. Yeah, no, I've been there a few times. Fantastic. I'm looking forward to being there. It's a lovely location.
Different continent, the guy picks a good hotel. I don't know how he does it.
The only thing I can't promise you is the weather that you get here in Southern California. It may not be quite so nice, but the hotel is amazing. It'll be great. And I'm sure the speakers, the content will be as good as it is here.
Richard, thank you for coming by to visit with me.
Great to see you, Ben. Thank you. Have a good one.